Chiropractic versus orthopedic surgery. What is the freaking difference? Today, I'm talking about chiropractic therapy versus orthopedic surgery, and I'm looking at what the differences are between these two fields of musculoskeletal care. Previously, I filmed a video where I reacted to chiropractic manipulation videos, and I shared my thoughts with the viewers about the procedures that were performed. In the video, I attempted to describe the role that I believe that chiropractors fill in the care of musculoskeletal injuries and complaints. With me, for example, in very simplified terms, I cut you open and I screw you back together. But for someone who can't get to the inside of you, it's about softening tissues and building muscle and mobility in areas that are weak so that your problem can resolve. That's it. And that is not a wham bam, thank you ma'am, super quick kind of fix.
Okay.
I offered an assessment of their knowledge base, their skill set, and their functional capabilities. While in some areas I was critical, I tried not to specifically bash chiropractors. I received a lot of comments on the video, some positive and some not so positive, as a result of the viewpoints that I shared in that video. Several commenters felt that I did not know what I was talking about, or that I was particularly biased in my opinions, or that I just simply did not understand what it was that chiropractors do or are attempting to achieve. So in this video, I'm not gonna react to anything. Instead, I'm gonna talk about chiropractors, family physicians, and orthopedic surgeons. And I'm going to compare and contrast these three professions so that I can better explain my position on chiropractors and chiropractic therapy. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 source for information on orthopedics and sports medicine that's easy to understand for everybody. Stick around to the end of the video to see my #1 piece of advice to consider when selecting a chiropractor, general physician, or surgeon. If you haven't seen my last video on the injuries from the crazy Russian slapping contest, be sure to check that out after you watch this video. That being said, subscribe to the channel, hit the notification bell, and let's get on with the freaking topic. So after reading some of the comments from my previous video, I felt that it was important to provide viewers with further explanation to address these comments, as it does not seem that all people understood what I was saying. Some examples of the comments that I received on the previous video include the following, and I'm gonna paraphrase here. Chiropractic care is less risky than medical care. Medical doctors won't or can't treat patients' problems, leading patients to seek chiropractic care out of necessity. Physicians shouldn't talk about chiropractic risks because people have died or being paralyzed by surgery. Doctors only want to give drugs and perform surgeries, while chiropractors only want to perform holistic care that includes manipulation. Errors associated with medical care are high, so you can't trust doctors. And doctors are basically stooges for the drug industry. So keeping these statements or comments in mind, let's compare these three professions to see how I established my position on the issues raised in the comments. Before I start, let me preface this discussion by stating that I don't think that physicians or surgeons are better than chiropractors. I think that we are different and that we serve different purposes. I think each of us performs a valuable role in the healthcare system. However, those that think that physicians and chiropractors are equivalent are wrong. Let me explain why. #1, education. General family physician, 4 years of undergraduate university, 4 years of medical school, 2 years of general family medicine residency, plus or minus 1 or more additional years of fellowship training for a grand total of 11 to 12, possibly even 13 years of training. However, during this time, the training is a relatively general nature, and only a small portion of this training, typically only a few months, is dedicated to musculoskeletal training. Chiropractic. This varies from school to school, However, for the purpose of this, I will say 4 years of undergraduate study, then 4 to 5 years of chiropractic training, and a 1-year fellowship, although additional fellowships are also possible. This is a total of approximately 9 to 10 years of training, much of which is dedicated to musculoskeletal therapeutic care. Orthopedic surgeon, 4 years of undergraduate study, 4 years of medical school, 5 years of orthopedic residency, 1 or more years of fellowship training. These days, it is not uncommon for residents to have completed 2 to 3 fellowship years after they have graduated training. This is a grand total of approximately 14 to 16 years of training, specifically in musculoskeletal diseases. So in the end, chiropractors may have more musculoskeletal training than a general or family physician, but they have significantly less than that of an orthopedic surgeon. This is simply math. Add it up. Number 2, title. Family physician, doctor. Chiropractic therapist, doctor. Orthopedic surgeon, doctor. All of these healthcare practitioners are given the title of doctor. However, 2 of these practitioners come from a medical stream, and the 3rd comes from an alternate stream of care. While I am not averse to the idea of a chiropractor having some sort of title, I do think that as their training is divergent from medical training once they enter into their clinical program, they should have a title that is unique to their profession, which distinguishes them from medical doctors. I do not believe that the 2 professions are equivalent, and I think that their titles should reflect that there is a difference. Do I think that orthopedic surgeons are better? No, I do not. I, however, think that they are different. Our training, our knowledge base, and our experience is not equivalent. Our titles should reflect that. Number 3, knowledge base. Here, I'm talking about the overall areas of medicine to which our skills apply. Family physician, a general medical foundation, overall general medical training, and a general knowledge of therapy. Chiropractic, general biologic foundational training, overall musculoskeletal therapy-based clinical education with a focus on therapeutic skills. Orthopedic surgeon, general medical foundation, an advanced medical training, specialized musculoskeletal diagnosis, assessment, and care training, and subspecialized musculoskeletal care training. It is important to point out here that family physicians, who are the first line of medical care in the conventional system, have only a small amount of training in musculoskeletal assessment and care, as their care envelope is large. So anyone expecting a family physician to have an extensive ability to diagnose and treat musculoskeletal problems is misguided. This is why family physicians refer to musculoskeletal specialists such as physiatrists, sports medicine physicians, and orthopedic surgeons. Typically, when presented with a musculoskeletal problem, family physicians will first attempt to address this problem themselves using standard techniques that have been taught to them during their training. If their initial efforts have been unsuccessful, they will then generally refer the patient to a musculoskeletal specialist. It should be noted here that the therapists to which family physicians will generally refer their patients prior to specialist consultations include physiotherapists, athletic therapists, and chiropractors, among others. If the system works as it should, then patients will see a chiropractor or some other form of therapist prior to seeing a musculoskeletal medical specialist. In fact, when patients come to see musculoskeletal specialists such as an orthopedic surgeon, one of the first things that we will ask them and expect to see is a history of some type of therapeutic care that has been attempted, but that has not proven successful. This includes chiropractic care. To state this more clearly, some family physicians refer to chiropractors. Some specialists also refer to chiropractors. Now, People have commented that I am not qualified to speak about chiropractic therapy since I do not have specific training in this profession. However, both professions have a basic training in human biology and physiology, and to this extent, both fields are similar. In addition, orthopedic surgeons have several years of focused musculoskeletal care training beyond the basic training. This, I believe, is sufficient to allow me to make some generalized commentary about chiropractic therapy, although I can only use the scientific literature available to speak about specific therapeutic techniques or practices. Number 4, diagnostic capacity. What I'm referring to here is our ability to diagnose musculoskeletal medical problems and our ability to use and order diagnostic tools to help with our ultimate diagnosis of the musculoskeletal problem at hand. Family physicians, all diagnostic modalities, including X-ray, ultrasound, CT scan, bone scan, MRI, and any other medical test which is available for use in a hospital setting. Chiropractic, X-rays primarily, MRI in some jurisdictions but not all. Orthopedic surgeon, all diagnostic modalities, including X-ray, ultrasound, CT scan, bone scan, MRI, and any other diagnostic modality which is available in a hospital. Diagnostic surgeries and invasive diagnostic procedures as well. Consequently, although chiropractic therapists have a basic understanding of musculoskeletal imaging that likely surpasses that of the average family physician, their exposure to the various types of imaging is significantly less than that of an orthopedic specialist. When compared to a chiropractor, a family physician has access to more information but has less ability where musculoskeletal diagnoses are concerned to decode the information that is available for review. The chiropractor, on the other hand, when compared to a family physician, has probably a better ability than the family physician to decode the musculoskeletal imaging that is available. However, they have an extremely limited opportunity to order diagnostic imaging and generally are working with only a small set of diagnostic modalities from which to form their opinions. When compared to either a family physician or a chiropractor, the orthopedic surgeon has the most information available and the greatest ability with which to decode all of that information that is available from diagnostic imaging studies and other diagnostic tests and procedures. Number 5, treatment options available for use. Here I am referring to the therapeutic options that are available for the treatment of musculoskeletal problems, either to be ordered or to be performed by the medical professional in question. Family physician, non-operative modalities only, including pharmacological treatments such as drugs and all therapeutic modalities. It is important to point out here that the family physician is not the one generally performing the therapeutic modalities. Typically, they would prescribe these treatments and refer the patient for these modalities to a therapeutic specialist such as a physiotherapist or a chiropractor. Chiropractic, non-operative treatments only, including only therapeutic modalities. Chiropractors do not have any ability to prescribe pharmacologic agents or drugs. However, with chiropractors, the therapeutic modalities are typically performed by the chiropractor themselves. And generally, the patients are not referred to another therapeutic specialist for additional care, although they may partner with other therapists such as massage therapists or acupuncturists. Orthopedic surgeon, non-operative treatment modalities and operative treatment modalities, including pharmacologic and therapeutic procedures, as well as diagnostic and therapeutic surgical procedures. In this case, orthopedic surgeons would be directly prescribing medication when indicated and would also be performing surgical procedures when required. However, the surgeon would likely not be directly performing therapeutic procedures, instead likely referring patients to a therapeutic specialist for those specific modalities of care when they felt that surgical treatment or surgical management was not appropriate or required. Keep in mind here that chiropractors have one avenue of care that is available. If all you have is a hammer, then oddly to some, everything looks like a nail. Also note that many of the patients that are referred to us for surgical consideration are not appropriate surgical candidates, having problems that do not require surgical care. These patients are referred by us to other therapeutic specialists such as physiotherapists or chiropractors for ongoing care. We do not operate on every single patient that we see, contrary to popular belief, nor is every patient that we see an appropriate candidate for surgery. We have not given up on these patients. They are simply not appropriate for surgical care. Number 6, conditions treatable. Here, I'm talking about the conditions to which the care that is offered is applicable, not by my opinion, but by scientifically based study. Family physician, soft tissue problems, muscle-related malalignments of the musculoskeletal system, and musculoskeletal infections. In other words, family physicians are able to prescribe medication and/or therapeutic care to address only these musculoskeletal conditions. Chiropractor, primarily soft tissue problems plus or minus subluxations. While some chiropractors will proclaim their ability to treat medical, metabolic, or physiologic problems, these assertions have not been borne out in scientific study. If a chiropractor can prove with a double-blinded, randomized control study that is peer-reviewed with greater than level 3 evidence, then I will be happy to acknowledge it publicly. Orthopedic surgeon, soft tissue problems, fractures, dislocations, musculoskeletal malalignments, congenital deformities, spinal cord compression, nerve root compression, musculoskeletal tumors, musculoskeletal infections, and subluxations. Compared to both the family physician and the chiropractor, the sheer breadth of musculoskeletal problems which an orthopedic surgeon can directly address with their treatment is significantly larger than both the family physician and the chiropractor combined. It is important to note that here again, therapeutic modalities will generally not be performed by the orthopedic surgeon directly. Instead, therapeutic modalities will be referred to a musculoskeletal specialist. However, prescription of medications and surgical procedures of both a diagnostic and a therapeutic nature will be directly performed by the orthopedic surgeon themselves. Understand that chiropractors deal with one slice of the musculoskeletal pie, whereas the orthopedic specialist deals with the entire freaking pie. In fact, even family physicians deal with a larger piece of the pie than do chiropractors. More pie means more opportunity for potentially life or limb-threatening problems and more exposure to and opportunity for complications associated with severe injuries or illness. Given that chiropractors are only trying to deal with a relatively small portion of musculoskeletal problems, it should come as no surprise that their exposure to musculoskeletal complications is significantly less than it is with either family physicians or orthopedic surgeons. That is not rocket science. Which leads me to number 7, relative risk of complications. Here I am talking about the risk profile that's associated with musculoskeletal problems to which their treatment applies. Family physicians, their risk applies to both diagnosis and the treatment of musculoskeletal problems. However, given the small subset of problems to which their care applies, their risk is relatively low. Generally speaking, they are not involved with life or limb-threatening musculoskeletal problems, and therefore the risk for complications is small. Chiropractic. Here, the risk applies largely to treatment only, since for the most part, chiropractic's diagnostic capacity is quite limited based on the modalities that they themselves can prescribe and the small subset of musculoskeletal diagnoses to which their treatment is applicable. In other words, they don't generally treat severe musculoskeletal problems, and musculoskeletal problems they do treat are often after after diagnosis and referral from other musculoskeletal care providers. That being said, there are some procedures whose complications are relatively rare, but can be potentially devastating, such as vertebral artery dissection and strokes. Given their rarity, the overall risk is relatively low, but if it happens to you, orthopedic surgeons, here the risk is quite high, relatively speaking, when compared with either the family physician or the chiropractor. The orthopedic surgeon is responsible for the diagnosis, treatment, and for the surgical care of all musculoskeletal conditions. More specifically, they are the ones that are responsible for the care and the treatment of musculoskeletal problems that have failed care by non-operative means by all other musculoskeletal care specialists, including family physicians, physiatrists, athletic therapists, physiotherapists, and chiropractic therapists. In fact, if the medical system is working properly, then the only cases that arrive at the orthopedic surgeon's office should be those cases that have failed all other types of treatment, including chiropractic care. Therefore, since these cases that are referred to an orthopedic surgeon have already failed other treatment modalities, the likelihood of their severity and their chance for complications is substantially higher than it would be for a chiropractor who is treating the typical uncomplicated musculoskeletal soft tissue problem. Furthermore, since the surgical treatments directly offered by an orthopedic surgeon are by their nature an invasive procedure, it makes sense that the risk profile associated with surgical care would be higher than that associated with chiropractic care, which is a treatment modality that is applied externally only. Finally, number 8, functional purpose. Here I'm referring to the overarching role of the medical professional in question. Family physician. Their role is largely the diagnosis of general medical problems primarily, but also the initial diagnosis of musculoskeletal problems, as well as the treatment of general medical problems and minor musculoskeletal problems. Basically, they are able to diagnose and treat a large number of relatively simple medical problems. Chiropractor. Their focus is largely the therapeutic treatment of a relatively small number of musculoskeletal problems. Their role in diagnosis is limited and is comparable to that of a family physician, but with much less diagnostic power. Their primary role is therapeutic care. Although they do have some diagnostic capacity, diagnosis is not their focus, and their diagnostic toolbox is limited with respect to the modalities that are available for diagnostic use and with respect to the musculoskeletal conditions that can be diagnosed. They possess a small set of therapeutic tools used to treat musculoskeletal problems. Orthopedic surgeon. An orthopedic surgeon's role is for the diagnosis and treatment of both simple and complex musculoskeletal problems. Their job is both equal parts diagnosis and treatment. In the conventional medical system, the orthopedic surgeon is positioned as the last stop on a patient's musculoskeletal journey. The orthopedic surgeon's job is to diagnose that which has not or cannot be diagnosed by other musculoskeletal specialists. In addition, their role is to treat that which has not or cannot be treated by other musculoskeletal care specialists. You don't come to an orthopedic surgeon first. You come to an orthopedic surgeon last. In some cases, an orthopedic surgeon will employ the use of other musculoskeletal care therapists for treatment of particular problems. However, in these cases, the diagnosis has already been made by the orthopedic surgeon, and the surgeon has deemed this problem to be either non-surgical or to require adjunctive therapeutic care before or after orthopedic surgery. As I said in the beginning, orthopedic surgeons and general practice physicians are not better than chiropractors. We are different. Our roles in the medical system are unique from one another, with medical specialists having more of a focus on diagnosis and non-therapeutic treatment, and chiropractic specialists, on the other hand, having a focus primarily on therapeutic treatment of a small subset of musculoskeletal disorders. Based on their knowledge base and skill set, chiropractors have a significant amount of overlap with physiotherapists who also perform therapeutic modalities. They provide a role in the musculoskeletal system that precedes orthopedic surgeons in the treatment of simple musculoskeletal problems, as well as following orthopedic care in the rehabilitation of musculoskeletal deficits after surgery. However, they are not and will not be a replacement for orthopedic surgeons or for orthopedic care. The breadth of conditions that an orthopedic surgeon treats is more broad than that of the chiropractor. The range of tools that we have available for diagnosis is significantly larger than that available for chiropractors. And the range of treatments that we have available for use is more varied than with the chiropractor. Do we perform the actual hands-on therapy that the chiropractors do? Generally, no, we do not. That has not been our role in the conventional medical system, and that is not where our expertise lies. Orthopedic surgeons are kind of like the quarterback, with ancillary musculoskeletal care providers, including chiropractors, being like members of the multifaceted offense pitted against musculoskeletal complaints. Could you win games without a wide receiver or a running back? Yeah, I think so, although it might be difficult. But are you going to be successful if you field a team that has no freaking quarterback? I think Las Vegas oddmakers might have something to say about that. So, should you go to a chiropractor for chiropractic care? Ultimately, the choice is yours. However, you should recognize that a chiropractor is not a replacement for an orthopedic surgeon. We typically don't treat the same problems. The severity of the problems that we treat is usually worse. Consequently, the procedures that we perform and the conditions that we treat are associated with a higher risk profile than for a chiropractor. But one thing is very, very true. And this right here is my single most important piece of advice when selecting a physician, therapist, or a chiropractor for your treatment. Whether you are going to see a physical therapist, family physician, chiropractic therapist, athletic therapist, or a surgeon, any musculoskeletal specialist or therapist that tells you that you need to return to them indefinitely for maintenance care and does not give you the tools and the knowledge with which you can learn to take care of yourself without their assistance should give you cause for pause. Now, let's look at my favorite comments from the previous video. If you like my content, like, comment, and subscribe so that I can feed the algorithm beast, because it lets them know that you like what I'm doing. If you want to be part of the team that helps with the preparation of videos and the selection of topics, then you can join some of my patrons like Andreas Hufton from Norway by checking out my Patreon page. There's a link in the description down below. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.